AI safety is simply making sure that AI does not harm humans. And this is not in the way like you immediately think. This is not in the way that, oh, I'll make sure that if the AI gets out of control, we'll put it in a cage, or I'll prevent super AGI. No, this is simply in a way that we want to make sure that when we are using AI, we are using it in the right way. We are not adding more biases than there are. We are not making a situation worse than there is.
It's very common in computer science and AI to have a red team, a team that's actually trying to poke at the model and find inconsistencies or weak points within the model. I just love that idea. Is there such thing as a clinical AI red team? If there is, I want to be a part of it. It sounds so cool.
At least we don't have it. I don't think there is one in the UK as of now. Maybe as part of...
That'd be so fun.
Oh, we should, 100%. And I think that would be, exactly. Your job is just to try to trick the model and try to get it to output something it shouldn't.
That's great. Okay, so for the listeners, if you want to form a red team with me and Joko, get in touch. It's going to happen.
No, this is like one of the things that I really think I needed.
Hello and welcome to Dev and Doc, a podcast where developers and doctors have a cup of tea and discuss AI and healthcare. My name's Josh. I am a neurologist and an AI clinical research fellow, and I am your co-host. And with me today is...
Jelko, and I am the developer.
So today we're going to discuss something a little bit different, which is all about AI risk and what that means and why we should care about it in healthcare in particular. So, Jelko, why don't you kick us off with talking a bit about AI safety?
Yeah, I think AI safety is all over the news currently, and I think a lot of people and media especially is presenting it a bit in a, I don't know, it seems like end of the world scenario. So I think AI safety is not all about that. I think that's like 1% of the general AI safety concept. And there is in fact much more that needs to go in it. That is much more like, much simpler, much nicer. There is no AI doom. It is simply how to make sure that AI is helping and not harming.
But I still remember, was in March, do you remember when, GPT-3 was being trained in GPT-4, and then Elon Musk, as well as some of the other big researchers, all banded together and said, let's pause these kind of large language experiments, building these large models, because we don't know what's going to come of it. Was that also just fear-mongering, you think?
Yeah, because what they said is like, let's pause these for 6 months because, everything is going too fast. And we didn't pause it for 6 months. We continued. And I don't think anything bad happened. I think, in fact, many good things happened. So I think it was a bit of a too soon of a reaction. I think we first need to at least a bit understand and know that it will not happen that fast. Because they were talking about basically like not even what is currently called like AGI, which is like artificial general intelligence, which is simply an AI that can do many different tasks. What they were talking about is like super AGI. So an AI that will overcome humans in a span of days and become so smart that we are not going to be able to control it. And that didn't happen in 6 months. So I think it was a bit of maybe fear-mongering, maybe just...
Yeah, but just playing the devil's advocate, it turned out to be okay, but we don't know when it will surpass, right? But because I think this all spanned from the GPT-3 paper, right? Emergent properties coming from these language models. And what that means is with more data, they realized the model started learning things which researchers weren't expecting it to learn. So it started being able to generalize on different tasks. So I guess the hypothetical risk is that how much do we know about what a model can actually know and learn in the future if we keep feeding it data? Are there possible blind spots which we don't know about, which if we kept going bigger, the model might actually pose certain risks to our civilization.
I mean, I think it is a very big leap to go from, oh, we trained the model on a lot of text and now it can hold a conversation, to, oh, now the model is so smart that it will be human extinction. So I think there was quite a big leap there. I don't think it is like so small, and people just got a bit scared of, oh, that GPT-3 thing happened, so now in a couple of months we will have GPT-7 and that will be smarter than everything else. So I think the leap was a bit too much, which did prove to be true. Like,
yeah, but we're only talking about it because it's true. Like, if actually something happened and they enslaved the human race, we wouldn't be sitting here talking about it right now.
No, yeah, exactly, of course. But I think it is just a matter of like probabilities. How probable is something like that? So, of course, there is a possibility that something like that happens. But if the probability is like 0.00001%, then we should, have it in mind, but we should not dedicate every resource ever into this, and we should not pause all progress and now start thinking about how do we save ourselves from that super AGI.
Agreed. Yeah.
Maybe to go back to the definitions and just to understand a bit more about AI safety. So go back from that fear of super AGI to really what AI safety is about, and in fact, what do we want to address with AI safety, and in even like what's the definition of AI safety. And I think in some very loose terms, or a very general term, is AI safety is simply making sure that AI does not harm humans. And this is not in the way like you immediately think. This is not in the way that, oh, I'll make sure that if the AI gets out of control, we'll put it in a cage, or I'll prevent super AGI. No, this is simply in a way that we want to make sure that when we are using AI, we are using it in the right way. We are not adding more biases than there are. We are not making a situation worse than there is. And a very simple example in healthcare would be that if we have created an AI to diagnose a patient or find cancer in chest x-rays, we simply want to make sure that the AI is validated, tested on enough examples, and that it is working as it should, that it is not missing a diagnosis, because if it misses something, a patient goes undiagnosed and the AI is harming humans. So like harm in that way, if that makes sense.
Yeah, I mean, there's a gray area though, right? So one side is just poor performance of the model / biases, right? So like, for example, all these models trained, I think, the skin cancer one is the best example, because a lot of these data sets don't contain people from ethnic minorities or people with dark skin. So a lot of these skin models designed to detect skin cancer, they realized in studies that it's a lot more sensitive and specific to people with paler skin types and white skin, whereas the darkest skin types don't get picked up as much. So that is a risk and that is safety. But how do you balance it between just saying, oh, this model is a bit biased and performs poorly in this demographic, versus saying that it's unsafe?
No, I think that is it. That is the safety concern there. Like exactly the example you mentioned is a safety concern. That model would be unsafe if deployed. Not because unsafe because it will overtake a hospital. No, unsafe because it will bring harm if it is used. So I think that's the main point of AI safety.
Yeah, sure. I mean, the catastrophic risks are still there, but like you said, it's very minute, low chance. But yeah, I guess that's not what most people are talking about when they talk about safety.
That's what, exactly. That's what most AI people, when they are talking about, or computer science people, when they are talking about AI safety, they mostly mean these in 99% of cases. And I think this is the risk we should be talking about today, and this is the concern we should be talking about today. The super AGI, sure, we can dedicate a bit of resources to that also, but I think that can be left for a bit later. And now just make sure that the AI models that we are using are used in the right way for the appropriate use case and are properly validated.
Yeah, and can I just make a small point here between AI safety and AI regulation? Because there is a distinction, right? AI safety is, as you mentioned, deploying models that are unbiased, that perform well, that don't lead us into blind spots that can harm patients or users. Whereas AI regulation is a bit different. Theoretically, you can get a really bad, crappy AI model that's been approved for regulation, right? As long as that fits the intended use case. So regulation's a bit different. Regulation's about jumping through the hoops, getting those tick boxes in, about data structure and performance to a level that the regulators are happy with, and that can differ from country to country, right?
Yeah, but I mean, shouldn't that be the same? Like, shouldn't AI regulation be there to ensure AI safety? I mean, why are the hoops then there? Why are we jumping through these hoops? What's the reason for them to exist?
Yeah, but regulation, I agree there's a significant overlap, but the regulation really boils down to the intended use case statement. So, what that model is for specifically. So I guess if you specify this is a model that is to be used in this very niche demographic, theoretically it can be regulated. Like, it could pass regulation, but it wouldn't necessarily be safe in a general setting, if that makes sense. But
yeah, I mean, but also you wouldn't use it in a general setting. I mean, I really think that they should be working together, like, because then I don't really get what's the point of regulation if it's just there to, I don't know, get a model approved.
Yeah.
I think the main point should be that I do the regulation points so that someone using that model can be sure that everything is fine. If I jump through all the hoops, then that model can be used for the use case someone wants.
Yeah, fair enough. Yeah, I think you're right. Like, they should be aligned, but I think I just wanted to make the point that they aren't always aligned.
Yeah,
and just because something is regulated doesn't mean it's safe.
With that, I agree, and that's something like we should change. That's something I think we should work on so that the regulations is really reflecting the safety of the model or the purpose of the model. So there was quite a bit of talk recently about AI regulation. There is an AI summit, AI safety summit happening in the UK, I think in a couple of days. The UK government is trying to position themselves as like the leader in AI safety. And I think they're doing quite a lot. Some things are very nice. Some statements I saw a bit out of the box, I think. Like one that was just reported by BBC a couple of days ago, where the Prime Minister in UK is talking about AI safety. And I'll just briefly read this out. He's basically saying like the title is AI could help it make easier to build chemical and biological weapons. And then like going at the end of that paragraph is like, mitigating the risk of human extinction from AI should be a global priority. I was like, what is happening? It reads like an SF book. When did we go from, we are making named entity recognition and like simple chatbots to global priority of AI extinction?
Rishi just wants to hop on the wave.
Yeah, I think there are some very good points here, but the way it's, I think, portrayed in media is a bit over the top. Probably you get more clicks if you say everyone will die from AI, but...
Yeah, but there was that, when ChatGPT first came out and they managed to, make it describe how to make like a Molotov cocktail for a bomb.
Yes.
So maybe it's just, maybe he saw that and just basically decided to put his own spin on it.
Yeah, and I was just thinking about that example. First of all, like a Molotov cocktail is not a hard thing to make. I think like Googling that for 5 seconds, you'll find how to make that. Even me just thinking about it, I'll be able to make it. Like I don't even need to do anything. Yeah, because like that is, there is a
and fire.
Yeah, but there is a big difference between making new biochemical weapons and making a Molotov cocktail. I mean, I don't know. I think we should make a differentiation between those two.
Yeah, sort it out, Rishi. But it's good he's paying attention to AI safety, I guess. So bringing it back to this AI safety summit, what were the key points they were trying to make here?
So I think there are a couple of things. I'll not go through all of them, but some things probably make sense to mention and are very good. I think one thing we should all be careful about is not to overregulate stuff, not to regulate because of regulation. And this is something also like Rishi Sunak was talking about, which was like, I think, a very good point. So it's not all bad. Like there are some nice things. So he was also talking about, do not overregulate. Do not regulate just because we fear the unknown. We should see how things play out a bit and what is happening, and then really properly think about it. So I think
the problem. Sorry, I just wanted to add here. The problem with these statements is that it's very vague, right? Like, okay, the point that we need to balance innovation and safety so it doesn't stifle progress, I completely agree. But what does that actually mean? Like I've seen some papers say, any research done below like GPT-4 is completely fine, or like, do we put like a parameter limit of when we should be regulating it more? Or, what does that actually mean for a researcher? Like when should I be regulated and when shouldn't I be? Or when should I be careful or not?
Yeah, I think that's a good question. And I don't think that's easy to decide. And that's really something where all of us should come together and try to understand. I think that's one of the reasons why this AI Safety Summit is a good thing. If you get university professors, if you get industry, if you get really people also, and try to combine everyone's opinions or get everyone's outlook, and then try to understand like where are the limits that we should put and how that should be done, and again still try to make it simple and try to not stifle progress, try to make it so that most people can still do everything they want, because that is still true. Most people will not invent that super AI. I think that goes to people that have tens of thousands of GPUs and are running ultra large models or whatever.
Exactly. And those are the companies that should be carefully looked at. Those big companies with the compute, with the GPUs, with the power, with the money, with the kind of lobbying strength. Meta, OpenAI, Amazon, Google, etc. Those are the companies which there should be some safety. Well, should be more safety teams at least looking at what could result from their research and their models they're building.
Yeah, no, I agree. And again, it is more into making sure the AI is safe to use, not to make super AGI, but again, to make sure we are not misusing the AI for simple things. But okay, to go back to this AI Safety Summit, maybe mention a couple of things there. So the first point they have is exactly the point we were just discussing. So it is like responsible capability scaling. And this goes into, should I immediately jump to a model that now has, 10 times more data, 10 times more parameters, and is 10 times more powerful? And they're just saying like, maybe we should be careful here and be a bit responsible and make sure that we are not overdoing this. And I think it's fine. We should be a bit careful, but I really think like the concern here is very minimal. I very much like what Yann Lecunn is talking and he's saying basically around this area of scaling and super AI. We can like post his, he was recently writing on Twitter about this. And he's basically on the side that we will get nowhere by simply scaling. So we will not get to that super AGI by just scaling. So this is just to say that there are experts on both sides. There are experts that are saying like, oh, making a 10 times bigger language model will not bring us anywhere. It will still make the same mistake. Will still do the hallucinations. Will still be fairly dumb. And there are also the other side that is like saying, oh, this will be the end of the world. So maybe find like a middle ground and just make sure both sides are happy and at rest.
Yeah. So just diving a little bit more into Yann Lecunn's point. So Yann Lecunn, for those who don't know, is a kind of leading professor in AI, and he works in Meta as is it AI lead or CTO?
Head of AI.
Yeah. And he says basically the architecture of these large language models, i.e., autoregressive kind of transformers, he doesn't think that this architecture will ever yield AGI. So therefore, we shouldn't be that concerned. And he thinks that everything we've been doing and the research that we've been building on this is just trying to control all these shortcomings, which suggests that it's inherently not the kind of God architecture, because all these hallucinations, all these problems of controlling and regurgitation of stuff they've been trained on, this is going to be a recurring problem, and putting safety measures around it is just a bit like, putting tape on a big gushing wound. That this architecture he thinks that we need a new architecture before we start going anywhere near AGI, artificial general intelligence.
Yeah, and I do tend to agree. To be honest, to me, it would be very sad if the human intelligence or the human brain is replicated by something like a transformer. Like, to me, that would be like the human brain is like awesome. There is, I don't know, it's just, there is a million things happening there. There is like a nice complex architecture. Everything somehow makes sense when you're looking at that. And then all of it replicated by something called attention is all you need. It's like, oh, we just attend to every token, put it in a transformer, and that's it. I don't know. I think like it would be sad if the human consciousness was replicated with a transformer.
Yeah, it would make you think we're so designed so simply.
Yeah.
Like we can be emulated so easily. But you've changed your tune from, when we're doing the large language model episode, you were arguing that, we don't know yet. Maybe this is not enough data, and that maybe this transformer approach was enough to reach AGI.
No, yeah, I still agree with that. I'm just hoping it's not. I would not want it to be. I would want it like, I don't know, sometimes when you see something, you think like, oh, this is beautiful. I was recently, like, in the past 6 months learning about neuroscience and how the brain works and everything. And then I was like, man, like everything is nice. Everything makes sense. There is so like...
Does it though? I don't know. As a neuroscientist and neurologist, like it makes sense in the clinical sense, but then like we know which lobe controls what function, but then you get a bit deeper and, you go to the neuronal level, and we still don't really understand, like there's so many connections, how a memory is really formed, how a emotions really felt, how is consciousness really present. Like once you go a bit deeper, it's still very strange. Like we still don't really understand why things are. We can only interpret it at a very high level.
No, I agree with that. I agree that, or at least also the book that I was reading was saying that we don't understand many things, and a lot of these things are not clear to us. But just the architecture, the way it's made, basically to me, it looks nice. While the transformer does not look that nice. It seems like very simple. Like I just want to say that, like on one side you have 5 billion years of evolution to bring this human brain that is, I don't know, a marvel of nature, and then you have a transformer on the other side. I don't know. Let's hope that that's not the solution to human consciousness.
But if each generation is just one training cycle, then theoretically a transformer model has more training cycles than human generations in 4.5 billion years. I don't know. Someone needs to do the math.
Yeah, I still don't think so. I still think we are very short of that because the population
We've
is
gone
also
completely off topic, by the way.
Yeah. No, it's okay. Yeah. Let's switch back to AI safety.
AI safety, please. Yes.
Yeah.
What on earth are we talking about?
Okay, so
AI Summit. Responsible scaling is the one thing. What's the next?
Responsible scaling was... Yeah, responsible scaling is the one thing. I think it makes sense to some extent, but it should really be the smaller part. It should be like 5% of this AI safety. A couple of other things, and this one I consider the most important, which is model evaluations and red teaming. So evaluation and validation, in my opinion, and especially in healthcare, is one of the most important parts to understand, is that model safe to use? And how should it and for what should it be used? And I think most of our resources should go here. Because if someone puts out a model and is saying, okay, this model is now extracting mentions of diabetes from free text in patients. The most important part, if you are deploying that in your hospital, is you want to have your test set, you want to have your validation set, and you want to test that model on your data. If you test it on real world data, basically on data that is in the hospital, if you test it there and you get your, accuracy that is satisfying your needs, I can use this model. And
yeah. Well, you need to take it to other hospitals then, and then other languages, other countries, other demographics, and then you can say, okay, it's generalizable.
Yeah, no, it is true. Okay, here some borders have to be a bit defined because it does not make much sense if every model now we have to take to every country and test in it. I mean, the primary test for your hospital will be on your data.
Yeah.
Of course, the more hospitals we test it on, the better. And by still think the main test is on your data.
I love the idea of a red team. So for those who don't know what red teams are, long story short, I think the term was invented in World War II, when they're basically building defenses, like kind of constructions of defensive towers and stuff, and they hired people to see if they could break in to their own building. So same analogy. It's very common in computer science and AI to have a red team, a team that's actually trying to poke at the model and find inconsistencies or weak points within the model. I just love that idea. Is there such thing as a clinical AI red team? If there is, I want to be a part of it. It sounds so cool.
At least we don't have it. I don't think there is one in the UK as of now. Maybe as part of...
That'd be so fun.
Oh, we should, 100%. And I think that would be, exactly. Your job is just to try to trick the model and try to get it to output something it shouldn't.
That's great. Okay, so for the listeners, if you want to form a red team with me and Joko, get in touch. It's going to happen.
No, this is like one of the things that I really think I needed. Red teams are very popular in computer science and especially in security. So if you are talking about security of, bank systems or any kind of IT infrastructure, you usually have red teams. Sometimes in computer security, they are called white hackers or ethical hackers, which is basically you hire a hacker to try to hack into your bank system. If they do that, then they report the exploit and you fix it. And the same thing is here. So it is very necessary, and I really think most of our money, effort, everything should go into these two things: model evaluation, validation, and red teaming.
Nice. Yeah, let's do it.
Yeah. And
were there any? Sorry, keep going. Yeah.
I want to touch upon this just a bit more because I think this is not a lot of emphasis is put on this, or a little bit of emphasis put on this, especially in healthcare. Because I think to be able to have these validation sets, to have your data sets, you need to prepare like the infrastructure, you need to prepare the groundwork, you need to put a lot of work into it, so that, because if I've created a model today and I want to deploy it in a hospital, first of all, today that is extremely difficult. And just testing it on the hospital data, there is no test beds prepared. The IT infrastructure cannot even handle that in most hospitals. And let's not even talk about like testing it across multiple hospitals, just because there is no like one entity that, or there is no one place where that data is available. Hospitals even cannot communicate, cannot share data between themselves. Data is usually locked away. Like, we first need to prepare this test bed, we need to prepare this environment, so that when AI companies, when researchers, when even clinicians, anyone who comes with their model, you want to enable them to easily test it. And I think that's one of the main tasks that the government, the NHS, should be focusing on. It is enabling faster validation, testing, improvement of this AI, and not slowing it down with putting more rules. Just like if you prepare validation environments, anyone would do it. If there is a company now and you can tell it, oh, come to this place, or in this infrastructure, we have data from 15 million patients in the UK and you can test it, everyone would do it. There is no way someone would be like, oh no, I don't want to do that. Everyone would by themselves then want to do the validation, the testing, the AI safety.
Yeah. I mean, it's a misnomer, right? We're called the National Health Service, yet the data is completely fragmented between hospitals and trusts. Like, you know, we're lucky that here at St. Thomas's and King's College Hospital and the kind of London and Maudsley Hospital, the data is linked in some sense. But that, even getting that to happen was very difficult. Now just imagine nationally, the systems don't talk to each other. So it's very hard to actually test, even if we build a great model, very hard to actually take it across the UK and test it on different data sets.
Yeah, and even more, to train it on different data sets. I mean, if you want safe systems, one of the main things to do is enable people to use real data, enable companies to use real data, train on that data, so that the models can be used on such data. Like, it doesn't make sense that you're saying, or that government is talking about and the NHS is talking about AI safety, and then saying, like, yeah, but no data from any hospital can ever be accessed. It's like, we first need to solve that problem before we can go into talking about using AI in a safe manner.
Yeah, I mean, there are attempts, you know, even I know in our own trust, we've tried to create this kind of federated learning platform and a deployment kind of engine where, you know, we can deploy models and use data without actually taking the data outside of the trust. But this is very tough. I mean, so far, whoever's tried has also failed. Maybe it's a bit of overregulation on our parts with patient data. I don't know what you think about that.
Oh, I don't think it's a bit. I think it is so much overregulation that it is unbelievable. I mean, it makes no sense that over the last 20, 30, 40 years, since basically the electronic health records exists, that only at most maybe 1% of that data is used, and in most cases it's locked away in silos. That's like so much data that is just sitting around because everyone is so afraid to touch that data because of the amount of rules and regulation that exists. So that's also like one of my fears, and we should avoid that happening with AI safety, that we put so much regulation that then no one does it. I mean, it is what I think we also need to understand is that by doing this, we are not helping patients. Like, I don't know, I think we should be using these data to help patients.
Yeah, no, I completely agree. I think there is overregulation. I very much like the US approach because, you know, they have this HIPAA compliance framework. So if patient data is anonymized to a certain level, then you have a lot more freedom of use of that data. So I think I agree with that. I like that a lot. But in the UK, it seems to be a lot more stringent.
Yeah, and I don't know like when and how this started. We should really get someone from like the government to speak with us about this. Just because I think what we are doing, but not by not using the data, is we are inadvertently harming patients. Because these data can be used to help and to improve healthcare, but what we are saying is that, yeah, let's not do that because, I don't know, too dangerous. But it is also not that dangerous. Like, there is a million things we can already do that don't pose any danger, that can help us with that data, and that we have to do. Because...
Yeah, so I guess another way of phrasing it is that I guess we're not doing direct harm to patients, but because we're not making most use of the data, therefore, philosophically, you know, we are in effect doing some harm. It's like the saying, you know, evil prevails if a good man does nothing. So we're not doing as much as we can with this data. So breaking down those kind of barriers to getting the data would be very useful. I think we should start maybe having guests and talking to maybe more governmental people as to how these things are actually set up.
Yeah, and to understand why is it so difficult here when it's so easy in US? Like, what's the problem? Why are we not doing the same? Because we should be. There is a blueprint basically on how to do it, and we decided, okay, yeah, let's not do that. Let's not follow it.
Yeah.
So
yeah,
I think it
will be interesting to see if this, if anything bad has come from using HIPAA compliant notes, and whether someone did find some way to trace a patient back and abuse that data. But I don't think there has been, or else we would have heard about it.
Yeah, for sure. And like, one other very important thing is, I do think we are a bit overly concerned about the patient privacy. If you would ask me, do you want to share your data? I'll be like, sure, do whatever you want. But no one asked me. If you ask, so can I make your data public but simply remove your name? I'll be like, sure, do everything. If that will help, yes, of course. And I think there are many patients like that. We were recently in Young
Parkinson's conference. Yeah.
Yes, conference for people with Parkinson's. It was young onset, and basically almost everyone there was very happy for people to use their data and find, I don't know, new cures for Parkinson's, or try to do something, or do anything they can just to help people with Parkinson's. But we are still not doing anything. So yeah, do not go too much into this. I think it is obvious that we have to do something, and that this data has to be used, and it's not as dangerous as everyone is talking. And in the end, I always say this, but Google knows everything about us already. And I think we were talking about this before. Google already knows probably every disease you have ever had, because there is no person that I know that did not Google their symptoms, and they remember everything. So like, yeah, there are ways to do that, and it is not as dangerous as maybe we are thinking.
Yeah. I mean, Google definitely knows everything about me, like any symptoms I've ever Googled, you know, all the data from my smartwatch, like my shopping habits. Although actually maybe it doesn't know my condition, well, I don't have a condition, number one, but I guess as a doctor, I'm searching for all kinds of conditions all the time. So unless Google thinks I'm just a super sick person with like a million diseases.
Yeah, that's true. You could be.
But Google would know I'm a
it.
doctor. I'm sure Google would know I'm a doctor.
100% easily.
Yeah.
And I think also it is very easy to differentiate between you looking for your symptom versus you looking for someone else's symptom. It is. I think Google can differentiate between that. But in any case, do not go too much into how bad Google is and how they know everything about us. In any case, we should use the data for good.
So was there anything else you wanted to cover from this AI Safety Summit? There's a few more points here.
Yeah, I think there is quite a few points, but another one that I like quite a bit and I think we should focus on is prioritizing research. They are in fact mentioning research in a sphere of research on risks, but I do think research in general, because the more researchers are working on these, the better we are going to understand these models, the more we are going to know about them, the better we are going to get at, controlling them, getting them to output what we want, aligning them to human benefits and all of that. Because if a lot of people are working on it, we have a lot of manpower basically trying to understand the models. And I think one of the biggest things why initially with GPT-3 there was a bit of fear is because we did not understand it. It was a big jump that happened and everyone got scared because this was, what's happening? There was one group that achieved this, no one else almost knew about it. So I think there was fear of the unknown. And the more we learn about it, the more we research it, the more known it becomes and the better we can use the tools.
But there is an interesting article I read, and that was just saying that yes, there is a lot of research on AI. Obviously, there's new paper every single day, many papers, but the proportion between AI safety and other AI research is ginormous. I think something like less than 1% of papers published focus on the safety aspects.
Do you
think there needs to be? Yeah, do you think there needs to be more people deliberately looking into AI safety?
I again think we are a bit confusing what is AI safety. Anyone who is testing a model, almost every paper that you and I have done and that is done in King's College Hospital and in the university, a lot of them are doing a portion of AI safety. Because a lot of them are testing, validating these models on clinical use cases. And I think you are doing AI safety with that. It does not have to have in the title of the paper, the AI safety of large language models. I think we don't need that many of those papers, and the 1% or a couple of percent I think is good enough.
Interesting. Yeah, I agree for the models we're building now. Because the models we're building are narrow use cases, right? I guess we have yet to have a generalizable model in healthcare or in probably most industries, right? When the model comes that can do lots of different things and can be spread across different use cases, then it gets a bit trickier. Because then it's not as simple as just saying, okay, it performs poorly on here, there's bias in this thing. I think if you can interact with it in many ways, like ChatGPT, then you need to doing more concerted hypothesis based on AI safety specifically.
Yes. It does make sense. I think the moment you have a general model, I do think you are still doing a fairly similar thing, but you are just doing it for many different areas. If you're testing a general model, instead of doing that validation on a specific disease, then you are doing that validation on many, many diseases, and you are trying to break it on many, many ways. So it's just the scale, I think, is much bigger, but the task is still relatively similar to the validation of one model on one task.
Yeah, but I guess I mean, like, for example, let's say for argument's sake, ChatGPT or Google Bard or GPT-4, whatever, has somehow been regulated and approved for healthcare use. And let's say it's been approved for kind of summarizing patient notes and for you to ask it what diagnosis it would recommend and what treatments. And you can interact with it in many different ways. Then that's a bit tricky because you don't just set off with a research to say, oh, does it give you the right diagnosis in this group of patients, or does it give the right treatment in this group of patients? But then it becomes, am I interacting with it correctly, or are there ways in which my prompting or my interaction with the model can lead to harm? And I don't think there's as much research going on for that kind of thing. Like I saw a paper that said that a person's biases is basically magnified by the model when you interact with it. So these kind of things need more research, in my opinion, if there is a generalizable model.
I agree with the last part. So I completely agree with the part that such a model can amplify biases, because it really depends in the way you ask something.
Exactly.
Yeah, the way you pose the question, then it can give you a different answer. And I'm, of course, perfectly for exploring that area a bit more, trying to understand a bit more the safety of that side. But the initial part of having ChatGPT approved for a general use case in healthcare, I don't think that will be soon. I think we will start bit by bit, and the time when we are going to get to a point where, oh, now you can use ChatGPT to just chat about your patient, I think we have quite a bit to get there, and we'll need many of these small incremental steps where we are testing it for one thing until we get there. But
so is your thought that the AI safety research will start ramping up as the models become better and more generalizable? So you're saying we don't need to deliberately stop research, deliberately stop building models until we're a bit closer and we see that this frontier is being crossed?
I would say so. I would say until we get to the point that, I don't know, you really see that the model is now becoming... I would say that what I would like to see is the model making something or proposing something or a research idea or doing a research paper that a human hasn't made. So like knowledge that a human has not generated, basically doing completely new novel research. And then I would start thinking, okay, it found some connections that it is getting like smart. It's getting...
I mean, this is going into creativity and, whether these large models can have their like own unique viewpoints or add new ideas. But like, it's very complicated because a lot of new ideas that even humans make are actually just applying cross-disciplinary knowledge to a new domain. Right?
Yeah, that's true. I mean,
so in a way, if the model can join up different disciplines and propose, approaches that may yield benefit in another discipline that's not been applied before, is that novel?
I would still like it to do that. I basically want to say like, oh, here is diabetes research. Write me a new paper. Do something novel that no one ever has done. And if it writes a paper, then I'll start thinking, okay, it has a very good general understanding. It cannot do that today, of course.
It can do that with art. You can say, oh, join, a Warhol kind of style with like a cartoon style with like just a Pollock painting, and just make like a merge between the two. It can do that.
Yeah, but that's style transfer. I understand that. I'm still telling it everything. Take Andy Warhol, take this and create something new. And art is, again, still something different. I wanted to see do that in I don't know, in a research field, write the whole paper. Give me a research area and write me a 10-page paper that has everything, introduction, methods, results, everything is there and everything is perfect. Yeah. Once we get to that, I'll start thinking, okay, now we are crossing some boundaries.
Yeah, so in this episode, I think we've talked about a lot. We've talked about what AI safety is, how it's not just regulation, and how it's not about fear-mongering and this idea of a dangerous artificial general intelligence enslaving the human race. We're still very much doing kind of incremental AI safety with our research, and I think we should ramp that up as the model gets bigger and better. I think it's important to understand that the goal of AI safety is not to slow down innovation, but to assist it and to speed it up in the right direction. Was there anything else you wanted to add, Joko?
No, I completely agree with that. I think the main point is the goal of AI safety is to speed up innovation, to make it concrete, to make sure that we are going in the right direction. And I think if AI safety is done the right way, then we will get that. And that should be our focus. Make it simple, make it straightforward, and make sure it is speeding up, not slowing down.
Yes, and deliver the best kind of healthcare and opening up data so that we can train and test models for the betterment of our patients. And that's a wrap, I think.
Yep. Thank you very much for listening. Please subscribe and comment, and we'll see you next time. Bye-bye.
See you on the next one. Bye.